Quality matters. Hi, I'm Dr. Randy Hedder from St. Petersburg Endodontics. I want you to know that the most critical step of any root canal process is the proper disinfection of the interior of the tooth. If we don't stop bacteria from coming out of the root tip, the root canal won't heal. If the root canal doesn't heal, then you'll have to pay more to have the problem corrected. Why not get it done right the first time? Please watch this important 3-minute video on our supplemental disinfection technique. It improves our success and reduces postoperative pain. Few dentists are willing to take the extra time necessary to achieve this high level of disinfection. But at St. Pete Endodontics, quality matters, and we use this technique on every case. Let's start with a demonstration about how irrigation is done by most dentists today. Root canal irrigation is used to rinse and disinfect the nerve canal in the tooth. Traditional irrigation injects chemicals into the canal to flush out debris and kill bacteria. Most traditional needles are stiff and do not allow penetration to the full length of the canal. Disinfection can only occur where the fluid is delivered. If the fluid does not reach the root tip, bacterial contamination will persist. Consequently, the chances for healing will be reduced considerably. If too much injection pressure is used, the disinfectant can be pushed out into the bone, causing pain and swelling. Instead of using injection, we use suction. This technology safely draws the fluid to the root tip and into a special needle. This eliminates the chance of injecting the disinfecting fluid into the bone. The EndoVac system uses a special microsuction tip with 12 laser drilled holes to draw the disinfecting fluid to the root tip. It vacuums up the debris similar to what you would do with a vacuum cleaner at your home. A lot of debris is created by root canal files. The special suction tip can easily be clogged by the debris. Consequently, the special microsuction tip is used at the end of the procedure, and we'll get back to the microsuction tip in just a minute. We start with a larger plastic suction tip to remove most of the debris in the orifice of the canal. The larger tip is moved up and down the wider sections of the canal to vacuum up the debris and bacteria. This helps keep the microsuction tip from clogging. Time is needed for the debris to soften and come loose from the root canal walls. After the bulk of the debris is removed, we use the microsuction tip to clean and disinfect the critical root tip area. Once again, the debris needs time to loosen from the canal walls. Bubbles form as the bacteria and debris are dissolved. Notice the constant flow of the fresh disinfecting fluid into the root tip to keep the disinfecting process active. The microsuction tip is moved up and down the canal to suck up the bubbles and debris. After a sufficient amount of time, the microsuction tip is removed from the canal and the disinfecting fluid is allowed more time to work. This is a much more thorough and safer way to disinfect the root canal. Time is a very important element of the disinfection process. If the time is cut short, or even worse, if EndoVac isn't used at all, the chances for success will be reduced, especially if bacteria remain in the root tip. So give us a call at St. Pete Endodontics, where quality matters, and we'll do our best to get it done right the first time.